If you could change anything about your life, what would it be? Would you get a better job, be in better shape, have more time for friends and family? Doing what works can help. We talk with experts on everything from managing your money to getting over a scrap with your sweetheart. We're your guide to a better life. Now, here's your host for Doing What Works, Maureen Anderson.
If you or someone you know is depressed, I hope we can help. I hope we can help you seek help, that is, because Daryl Anderson, my husband and producer, and I are not doctors, and we don't pretend to be doctors on the radio.
Which is good.
Oh, it is.
It's good. We could get into lots of trouble now.
We could, and we can get into plenty of trouble without that. So
That's true. That's true.
We do, however, have the pleasure of hosting a doctor on this show today. She's a research psychologist, a psychoanalyst, and also happens to be the author of Life Begins at 60, a new view on motherhood, marriage, and reinventing ourselves. Dr. Frieda Birnbaum is an expert on depression as well as women's issues and happiness. It's great to have you back with us, Dr. Birnbaum.
Thank you so much. My pleasure.
What constitutes depression?
You know, there are many varied types of depression. So you could have moderate depression, which means it could be episodal. And so we often tend to go in that direction in our lives. You can't avoid it. Divorce, even marriage can be depressing. It's change. Anything that's change is depressing when you don't know what to expect. Even moving can be a state of depression, but they're episodal. And here's the difference. You know, clinical depression is when you actually can't even get out of bed in the morning. There's like a gray cloud hanging over you, and you have no energy before you even do anything. And that's long-lasting, and that's the concern.
That's an interesting point that I hadn't considered about how even seemingly positive changes can be depressing. I think of the teenager who is headed for college, he or she is sure, but doesn't know where. And there's something so unsettling about not having a target.
It's scary. It's very scary. Even when we have a target, the unknown. I'm just thinking that I sprained my ankle when I was walking down the aisle. I wonder what that meant. But anyway, you know, I was scared and I was depressed. I'm still trying to figure it out 40 years later, but whatever. So I'm just saying that, yes, we do live in a state of heightened anxiety today, for sure.
Yes, and marriage, as you were just bringing up, is exciting in one sense, but in another sense, you're closing off the rest of the world in some ways. I mean, it's the whole, you need to make a choice, and it's always fraught.
It's true. When you make a choice, you do eliminate other things in your life. But then again, you know, do you need to do that, and is this the priority? So you pick and choose priorities. Eventually, they do make sense. But, you know, we live in this society where we're overbooked. We have high expectations. We have fear, anger. Our economy's not doing that well. All that overrides other things that we're doing to become even more anxious. So when we talk about marriage, that's the cloud that's hanging over our heads as well. So it's not the way things used to be, you know, the simple life of going out on the farm and milking the cows. I mean, that was physical work, but, you know, that drained you. But mentally, psychologically, it didn't have the same effect the way people are affected today all over globally. We're talking about the world. We're talking about 300 million people. There's an epidemic here of hopelessness and depression going around us.
Do you think people were happier in the old days?
I think so. You know, my mother used to be here when I had my practice. I still have my practice, and my patients were coming in, and she'd say, "What do people have to talk about every week?" And, you know, and then I say, "Mom, just go in the other room when they come, please." She's like, "Look at them, like, what is going on?" Because to her, having food on the table and shelter what else was there to complain? And she used to say something funny. A man is like a broom. As long as you have one around, that's all that counts. So for her, any more depth, tell you that to your husband, any more depth than that was not necessary because she came from a place of poverty. It was a whole different need. As we evolve more, we need more. There's nothing wrong with that. We're more intuitive. We're more in tune with our needs. But with that, we question our lifestyles even more so. Our expectations are even higher. And because of that stress, that builds up, and that brings up anxiety, and then with that anxiety brings up depression as well.
Well, you're the perfect person to test this hypothesis on. I heard it from another doctor. He's a medical doctor, but he says that we romanticize the road not taken. Do you agree?
100%. You know, happiness is a fleeting moment. Even Freud said that, so it must be right. But you know what I'm saying.
Yep.
Freud knew all the answers. But I'm just saying that we expect that moment in time, and the real word is contentment. If we can find contentment in our lives, that means free of pain, free of concerns, then that's as good as it can get, because you know when you don't have that, you look back, you realize how lucky you really were.
Yes, I think the fastest way to realize you're not happy is when you find yourself telling yourself the following: I'll be happy when this happens.
You're so right, and that's the way a lot of us think. We're waiting for something to happen. We have difficulty living in the moment and enjoying where we are. So we'll either talk about what we could have, should have done, which is a big thing, or we're going to wait for our break. We're going to wait when the economy is better, when we find the right person, when we go on vacation, whatever that is. And then we find out vacations, if you go with the wrong person, it's a microcosm of all the problems. It's even worse. And so you always have to deal with yourself. So the best solution to that is you can't do anything that can make you happy unless you make yourself okay first.
I didn't foresee this, and I usually eschew it, but I think I want to talk politics in general with you for a minute, Dr. Birnbaum, because...
Whatever, you're the boss.
Not partisan politics, mind you, but I have been awed by the amount of time people have freed up in the past 6 months to rail against what is happening in Washington, D.C. I'm not saying either side doesn't have a point. I just didn't realize how many people had so much time.
Well, you know, he's replacing our Saturday Night Live here. He's our, get out the popcorn and have fun. So that's what we're doing with ourselves. And, I'm finding myself watching CNN and Fox News more than ever because you never know what's going to happen. But, we have to look at this realistically. As our president, if we don't support him, we're not supporting ourselves and our country. It's a very frightening time, and actually that's a big reason why there's depression as well, because of our what's going on politically. You can translate this two ways. You can give somebody an evil eye and say, twist the words and make it different. And the media is supposed to be impartial, and they're definitely not. And time again, we listen to the news according to how they view it, and it's definitely not neutral. So there is something to be said to give our president some time, to give him time to see things, to figure it out. He's absolutely not politically correct. That we know for a fact. And he's also learning on the job, and he's also changing his mind. But what he's doing, he's reinforcing leadership roles that we haven't done for a long, long time. We have become so global that when you help other people and you give them too much, we've been giving money to North Korea to feel safe, billions of dollars. What has that done? They just want more. So it's really not helping anything. It's just saving some time. And so we have to really confront what's going on, our fears, and, take care of a bully by becoming a bully. So we're not used to this kind of presidency. We've never had this kind of presidency. But maybe going global should be really about giving somebody opportunities to do well without giving them everything that they're asking for. And that's what we're doing. We're backing off, and it's making more sense.
I have heard of people who are blaming, and I'm not bashing them for blaming, although I don't think blaming as a hobby is necessarily the best use of time. But with that disclaimer, blaming their clinical depression on Trump, blaming their weight gain on Trump. And I'm like, are you kidding?
That's convenient.
Yeah.
That's very convenient. My goodness, now I have an excuse. Okay, I have better. Well, you're right. I mean, we live in a society in a time where we're overbooked, we're overly anxious, we're scared. There's a fear factor. What had happened the other day? I mean, was it last night that he came on the news and he said something may happen with North Korea? He's not reassuring us right now. But then again, this was always in the back of our minds. They were always threatening us, and now they're trying out these missiles. They're not even working fully, so that's reassuring as well. But as they continue this, they've always been there, and without confronting them, they're using tactics to bring this country down, to give us this fear factor, to take away the feeling of being a powerful country that we really are. So we really need to stabilize and reinforce who we are so we can continue to have the power that we used to have, that we have not really had. And I know a lot of people will agree and a lot won't with Obama.
Okay, I'm going to interrupt you to go to a break. We're talking about depression with Dr. Frieda Birnbaum. More to come on Doing What Works. Welcome back to Doing What Works. When the publicist for my guest today got in touch with me about the possibility of doing another show, I thought, of course, I remembered Dr. Frieda Birnbaum. I don't always remember my guests. We've been doing this long enough, Daryl. I've had hundreds of people on the show.
Very notable people.
So I take it as a good sign if I do remember the person, and I remember Frieda Birnbaum being a little bit of a firecracker, and that's the perfect guest, Frieda. We love firecrackers.
Yes, but you also are not inhibited. You're very warm. You are interesting, and you say exciting things. So that's what connects a person to an interviewer.
Oh my gosh.
Absolutely, and this is why it's more interesting to be with someone like you than someone who just asks me these rote questions. So you're the one that promotes this, if anything.
Oh my gosh. I don't need a therapist, but I kind of wish I did, because you would be it.
You don't need a therapist. Are you kidding me?
Although the minute I said that, I thought, yeah, the person who says they don't is usually the one who does.
The one who needs it the most. Yeah, exactly.
Listen, if I used to go to a group with therapists on Fridays. I don't have that leisure anymore. And they were the worst. They were crazy. They were off the wall. So what can I tell you?
We have a gentleman on the program from time to time who is a family therapist, and just recently he talked about the same type of thing, where a group of family therapists or therapy types get in these meetings together. And what was it that he said? They were practicing something. Do you remember, Maureen?
Oh no! I'll remember the minute we're finished. But go ahead.
But yeah, they were practicing doing some
hostile thing or drawing
with each other out. And he said it was just hilarious how it was going about, getting these therapists to act a lot like their patients did or something like that. Anyway.
It's called countertransference. I supervise some therapists, and that's true. They often are stuck with where their patients are, and it's hard to move forward. So that is a problem. But it does depend. If you go to someone, you should really walk out feeling that you're taking something with you, some kind of lesson, some kind of change in your life, because being understood is not enough. You can be understood for years and years and feeling connected, but to be able to have that kind of ammunition with you, that you can do something, and that builds upon itself, and that's how you keep evolving. And, and by the way, we all need to evolve. We all need to. As long as we're living, we want to learn and we want to change. So in that respect, therapy is a good thing as well. I find in my practice, the patients that are coming in now are really professional people, highly educated, successful, who just want to keep moving on. And people with depressive episodes and depression don't come in enough, and that is a problem.
And we'll get back to that topic in a moment, but since we're quickly running out of time in this segment, let's linger on that for just a second. When this show used to be the career clinic, I remember my brother asking me, why didn't I consider being a career coach? And I told him because I didn't have the patience. I can imagine throwing out this idea or that one and a person, spewing all these excuses as to why it couldn't happen, even though it actually could. And I just remember thinking I wouldn't have the patience for that. And Frieda, do you ever find yourself going, oh, come on, inside? I know you don't say that.
That's an excellent question, and you're reading me very well, because I don't do that kind of therapy. In order to be a psychoanalyst, you had to go to therapy 3 times a week and pay the regular price, which was very costly. And I promised myself that I would not do that to the people who came to see me. Life isn't long enough for all that. So I try to get on the program, take care of the solutions at the moment. As a therapist, you're not supposed to even help people. You're not supposed to connect on that level. But people are coming in because they want help, because they want change. And, as somebody who has objective points of view, I don't have any prejudice against them. I have to be a professional, and I have no agenda. They're safe doing that. And so that's really what's exciting about this kind of therapy that I do, and I think that's really needed, to have the ability to say, you know what, this is happening to me now.
When when I anticipated doing a show about depression, I thought, well, that sounds depressing. It hasn't been. I hope you're finding the same, and I can't wait for more with Dr. Frieda Birnbaum on Doing What Works. This is Doing What Works. Daryl Anderson, my husband and producer, and I both work from home together. You hear us on the radio together. We are together all the time. And as I'm fond of saying, we don't even have the occasional urge to kill each other. But I think one reason is that moods are catchy, and how you move through the world very much rubs off on the people you move through the world with. I bring it up because my guest on Doing What Works today, Dr. Frieda Birnbaum, is joining us to talk about depression. And Frieda, can you catch depression, silly as that sounds?
That's an excellent question, and no one has asked that, but it's so true. If you're around people who have a low libido, they often put you down, or they even want to put you down, because they feel better about that rather than being victimized all alone. So you have to be careful who your friends are. And, if you don't feel good about yourself after you talk to someone, it shows that that person is not right for you. Something is going on. So always, find a path for yourself where you do feel good so you can know the difference. And the minute you see there's something there that's not right. Either speak up or walk away.
You know, in my younger, misguided days, I had this mistaken belief that people who were unhappy wanted to be happy. And I realized at some point I was wrong. Some people are devoted to their unhappiness. They want you to be unhappy as well. And the only course of action, if I wanted to preserve my upbeat spirit, was to stay the heck away from them.
You know, you're so right. It reminds me of my mother, who I love dearly, but that's often the people you clash with. And so she would always dump all the garbage on me it's like I gave her a session every day, which exhausted me. Was my most difficult patient was my mother, the most problematic as well. So anyway, I finally confronted her and I said, you know, Ma, do you always have to talk about bad things? Don't you have anything good to say? You know, Frieda, if I can't talk to you, who can I talk to? So she liked to be the victim. It made her feel comfortable so she could lean on somebody. But the problem in life is victimization is never something that you can get out of. People really shy away from you when you do that. So it's best for you to not get stuck because you feel other people will take care of you. It's just a lazy way out.
Is that why you became a therapist, your mom?
I became a therapist not because of my mother, who was actually good, but, you know, when people get older, they often it's nothing personal, they get resentful, and I can understand that as well. But, no, I'm a second-generation Holocaust survivor, and I've always helped my parents through their own stigmas and prejudices. They were from Europe, so I found myself helping people, and then helping my friends when we were supposed to just have lunch out and relax. And so I said, what's wrong with this picture? You know, I feel a little bit depleted here.
Yeah.
So I said, you know, this is probably my area. And I went into other fields, respiratory therapy, and found myself helping people psychologically. So I sort of went in that direction.
Back to the question I asked about whether you can catch depression. You can? You're saying then?
Yes, if you're with a depressed person, and that person is giving you a feeling of being stripped of your own contentment because you're relating to that person. After all, you know, it's an effect. If you're with happy people, you're supported for that. If you're with people who are upset, look at life in a bleak way, if you're with those people long enough, after a while you can't escape those feelings as well. So you have to be very careful not to feel as if you're indebted to them, that you have to take care of them, because that's what's going to get you in trouble. It's not your problem and it's not your responsibility. And the best way to fend off from that, and that's with any type of relationship as well, is to not personalize it, say, I'm sorry, that's how you feel. And if you can do that, then you can sort of stave off from those negative feelings.
I look at it as a gravitational pull.
That sounds very good, because that's exactly what I'm saying in one sentence.
I also think, and a psychic, believe it or not, helped me with this. She said that people have this idea that family bonds are so sacred so as not to be broken, almost independent of the abuse you suffer, when, in her opinion at least, nobody in the afterlife cares about the bloodline. Wasn't that an interesting thing to say?
Well, that's something to look forward to, I guess. You know, I don't have to worry about it today. Not a bad idea. I'll just tell all my patients, you know, after life you'll be fine. Don't worry. You're not a problem. So, you know, it's a way of looking at today where you are and making lighter of it.
Sure.
Which is not a bad idea.
No. But on the other hand, given how I opened the show, I do feel a sense of responsibility now to start talking about clinical depression, because it is serious. And every day, I don't know if there are more suicides lately, Frieda, or if we're just more aware of them because they're publicized so much more.
You know, here's the thing. 800,000 people die due to suicide every year, and 300 million people of all ages suffer from depression globally, more than ever, and ages 15 to 29, well, it's the second leading cause of death. So, yes, this is an epidemic that we're in, and the problem is that fewer than half in our country and 10% in other countries even seek help because of the stigma, because we need to have free clinics. So they don't have that. So depression is rampant. Our society is more intense. We're less connected. We're more isolated with technology as well. That has created lots of depression. You know, in Europe, they even have street lights that are on the ground, so people who are looking at their cell phones will know when the lights are on. The stoplights say go or stop. That's crazy, but that's really what's going on in our society, lack of a community. So we are living a different life, and as you said before, one thing does have an effect on something else. And so our technology, which is wonderful, is having an effect on us psychologically. And then again, you know, the jobs, the millennials are in a place where they often are educated and they're living at home with no jobs. That's depressing for the parents who were baby boomers, or still are baby boomers, and the millennials who think very differently, and the income as well with the younger generation. They are stuck. If they don't have an education, there's no room to grow. They have about $30,000 income every year. And here's what's interesting also. The young women, ages 18 to 32, they're the ones that are getting the middle income job opportunities more than the men. So this is something that's creating depression for men as well. So we're really in a high rise of this situation.
When we come back, depression to me seems like a black hole and something that when you're in it, you're hurting so bad you don't even know just how badly you need help. And we'll ask Dr. Frieda Birnbaum what to do in that situation. This is Doing What Works.
Thanks for listening to Doing What Works and to our radio affiliate partners like KZNG in Hot Springs Park, Arkansas.
Back with Doing What Works. I'm Maureen Anderson, joined as always by my husband and producer, Daryl Anderson, and we are delighted to have Dr. Frieda Birnbaum with us today. We're talking about depression. And Frieda, depression seems like this catch-22 of a problem because when you, for example, have a stomach pain that's, that knocks you over, to either call 911 or have somebody drive you to the ER or whatever. But when you're hurting and it's not something people can see, and if you're hurting badly enough, how do you even know that this isn't permanent / fatal / whatever?
That's a very important question, and there are instances where you really can't sleep, you can't function, there's loss of pleasure, there's feeling of guilt and low sense of self. So that's not a passing moment. This can be described as depression. So there are a lot of ways of identifying this without having to skim over it. And that's how you know that you can do something about it as well, when you identify those moments. And we're talking about also doing something about it physically. When we are in a place that we have this kind of depressive moods, we can actually physically do something about it. And that is just talking, when we're talking about anything we want to talk about, we are relieving stress right there and then. And it's changing the image of yourself. Your expectations are different. Seeing other people, seeing other than Facebook, everyone's having a party, and that's creating depressive episodes as well. And you go out to lunch with somebody, get together with somebody, see that they also have issues. Not everyone's looking fantastic, going on vacations, and happy all the time. Those are unmet expectations. That's going to help you to realize that you're not in that horrible state all alone, but other people have situations that are similar to yourself.
This may seem flip. I don't mean it as such. I think there is science behind it, but I feel the need to throw it out. If someone came to me depressed, I would tell that person the following: clean up your diet, start getting enough sleep, and start working out hard and consistently. And after you've been doing that for 6 months, come back and see me. And I've heard that a lot of what goes wrong in our psyches is related to exactly that.
Well, you're absolutely right, but here's the problem. A lot of these people don't have the energy to do that. They don't have the impetus to feel joy. It's something that is difficult to describe when you've never had it. So yes, you're right, that could help if they could get to that point, but they can't often get to that place. They're lacking in motivation and in drive. At night, they're having sleepless moments of anxiety. They have negative thinking processes in them. So this is something that is very ingrained inside them, and it's something that they need to really study, behave in a certain way to get out of that funk, to get out of that real feeling that they really do have. And one way to do that is to think positive thoughts, to allow yourself not to sleep, to allow yourself to know that whatever you're thinking is horrible is going to leave, to be in touch with your body and to accept how you're feeling. Those are psychological factors that needs to be induced in people before they even get to the point that you're discussing. That is very valid. And once they get to that place, that's wonderful.
So listening to the person is key.
Listening to yourself, first of all. Listening to the fact that all your anxiety, what is really going on, no one's running after a gun shooting you. No one wants to kill you off, really. If your health is okay, and if it's not okay, then you go ahead and do something about it. So you're right, to be active, to be proactive with your situation is the best way to go. But a lot of people are helpless in doing that.
I have to break in when we come back. What to do if you suspect someone you love is depressed. This is Doing What Works.
Free life advice, whether you're 17 or 70. It's all right here every week on Doing What Works and online at MaureenAnderson.com.
Back with Doing What Works. There's a thing going around on the internet that I'm going to botch the quote, but something like, if knowledge was the answer, we'd all be billionaires with six-pack abs. It's not so much knowing what works as doing what works. That's why we named the program Doing What Works. And when it comes to depression, the topic today, Dr. Frieda Birnbaum joins us because Daryl and I are way out of our league here. Dr. Birnbaum, before we get too close to the end of the show and I have to cut you off for time, do you want to point someone to online resources now?
Well, I think that often people who are depressed need a relationship with someone. So it's best if you can find a therapist in your community that can understand you and deal with whether you need medication, antidepressants, someone who you could have cognitive therapy or behavioral therapy, which means they change your way of thinking. And that is something that you can do by looking online for a therapist in your area. So when we change our negative thoughts, our behavior changes with that, and that needs to be done on a one-on-one personal basis. And this can be very doable if you find the right person, so not to feel discouraged. And it's also important to know that it's not all often mental. It could be medical as well. Serotonin is often something that women lack in, and that they are born that way. And, you were right, exercise does help. It does lift your serotonin intake. That's why you feel so much better afterwards. And often the cortisol levels go up when you have this anxiety, and that helps eliminate that and repress those feelings. So, we just have to know that our cell phones, overscheduling, disconnecting from neighbors, can bring on depression as well, because of the society we live in, that we are really driven too much for success in competition, and our expectations are not often met. But what are those expectations? A relationship is the best thing to happiness, has nothing to do with money. Connecting to another human being that cares about you, that loves you, is as good as it can get. And of course, having your health comes first.
Sure. This is terribly unfair, Frieda, but in 2 minutes, we have 2 minutes left. If someone you love is depressed and hasn't already asked for help, how do you inspire that person to get help?
There's nothing wrong with confronting that person and saying, you know what? You seem a little bit off lately. Is everything okay? You're right. They could deny it completely. It's okay for you to say, I see that there's something wrong. Is there somebody you want to talk to? Let me know. Is there something you want to tell me? Let me know. And then you're opening up a channel for that person to say, you know what, maybe it is safe to change. Maybe it is safe to acknowledge it. And no one's above depression. Everyone has had some feelings of hopelessness in their lives. And you can relate that to that person as well. I haven't been feeling so well at all times, so I understand where you're coming from. So instead of having this sense of hierarchy, I'm better than you because you're not okay, to go ahead and to equate and to make that person feel that they're one of you and vice versa, that everyone is in the same boat at one time or other, more so or less so.
Listening without judgment.
Listening. See, you know how to put it into one word, one sentence. I can talk for an hour, and all of a sudden you say the same thing. Wait a minute.
No, well, it's radio and trying to cram everything in between commercials. Yeah. But thank you. Yeah. All right. Well, Dr. Frieda Birnbaum has a website. Let me give you that website, drfrieda.com, and it's DRFRIEDA, drfrieda.com. And you can read her blog. I was doing that last night. That's one reason I didn't get enough sleep.
Oh, sorry.
No. That's I'm trying to compliment you. And please get in touch with me. There's a contact page at MaureenAnderson.com if you would like more information from her as well. Meanwhile, we want to thank her very much for joining us, and thank you for listening to this edition of Doing What Works.
This broadcast is copyrighted by North Shore Productions. To learn more about the show, you're invited to visit MaureenAnderson.com. You can read Maureen's blog, listen to her podcast, or pass along suggestions for the program. I'm Cindy Weir. Thanks for listening, and tune in again next week for more great advice and inspiration on Doing What Works.